Hi, I'm Dr. Andre Sasson of Lighthouse Weight Loss. Today, surgery while on GLPs. Does taking GLPs make surgery riskier? No. Do you need to do anything different before surgery if you're taking GLPs? Yes. So, bottom line is GLPs do not make surgery riskier. If you're on a weekly shot, stop your shot a week before surgery and fast before your operation at least 8, maybe up to 24 hours if you want to be more cautious. And the risk of aspiration is extremely low. All right, let's get a little background. Why is it recommended that you fast before an operation? It's because the anesthesiologist wants you to have an empty stomach. Why do they want you to have an empty stomach? In case of the rare instance where you would vomit while asleep under anesthesia, if that happens, you have a risk of aspirating or inhaling your vomit into your lungs, and you don't want that. So they want you to have an empty stomach. However, the risk of aspiration is extremely low. It is estimated that how often this happens is 0.03% of operations, meaning 0.03%, super low. So for most patients, what they recommend is what the American Society of Anesthesiologists recommends is 8 hours of fasting. Typically, they'll tell you don't eat after midnight the night before your operation. Well, how does being on GLPs change the preoperative fasting guidelines? They're evolving. The most recent guidelines from the ASA, the American Society of Anesthesiologists, is that you stop your GLPs, if you're on a weekly shot, that you stop it a week before the surgery. And they recommend and they acknowledge that they haven't found the likelihood of people aspirating to be any higher when you're on GLPs than when you're not. But there have been rare isolated reported incidences of this happening, and it got media attention. So people, and it's known that you have delayed gastric emptying with the GLPs. So that's why they take the stand of stop your GLP a week before surgery. What about the fasting? The ASA statement is verbatim: there is no evidence to suggest the optimal duration of fasting for patients on GLP medications. So they recommend the standard fasting protocol, or 8 hours. However, this summer, June of 2025, a different organization, the Society for Perioperative Assessment and Quality Improvement, they came out with saying that people should fast 24 hours. The anesthesiologists haven't changed their position. What do you do? My advice is fast a minimum of 8 hours if you're on GLPs before surgery. If you want to be even more cautious, fast longer, up to 24 hours. Well, what about special considerations? What if you have to have emergency surgery and don't have an opportunity to fast? Don't worry about it. Emergency surgeries happen every day. I'm an ER doc. And people go to surgery with full stomachs. Anesthesiologists know this. They take special precautions. Just make sure you tell your physicians that you're on GLPs. And then the other special consideration is if you're a diabetic and you're coming off your GLPs before surgery, talk to your doctors about how you're going to control your sugar between that and your operation. Lastly, disclaimers. This is education, not medical advice. If you are having surgery, please follow the direction of your surgical team. Thank you, Dr. Andre Sasson, Lighthouse Weight Loss.